Hello, I'm here with Professor Michael Quinlan of the UNSW Business School. Michael, along with a set of leading lights of Australian industrial relations, has just put out a discussion paper on the new normal of COVID-19 life. Before we get to the economics, Michael, you make a number of points about the health and environmental effects of the virus, or perhaps more their management. Could you give us the key claims there?
Yeah, we actually had some public health people involved, some quite eminent ones, and that was very important. Public health experts and the World Health Organization had been warning about a major pandemic for some time, decades in fact. And the World Health Organization had actually been urging planning, which most countries weren't doing. In the early stages of the pandemic, the senior leadership of the World Health Organization issued some advice which I don't think was particularly helpful, and particularly not recommending against countries closing their borders, particularly to China, and it equivocating on wet markets and several other things. But it's advised after that, and delaying the announcing there was a pandemic. But beyond that, its advice was actually very good, and countries that followed that advice were clearly able to mitigate things better. The trouble was that the economy that had been created in most countries was singly unprepared to deal with this. We had moved away from government planning, government infrastructure, cut hospitals, the healthcare systems have been cut under neoliberalism. And this left countries in a very weak state to deal with it. They didn't have the resources. There wasn't the planning in place to deal with it. And those countries that didn't manage to keep a lid on the outbreak, therefore, ended up in very bad situation with, as we know now, hundreds of thousands of deaths, including many healthcare workers who were basically sacrificed because of the inadequacy of the healthcare system. So,
well, I think with that we really do move into the realm of economics, and just reading the paper, I kind of felt that there were a lot of issues. You look at the impacts of decades of neoliberalism, dismantling the state, as you say. You think of the virus as a supply-side economic shock. You consider the differentiated effects of the virus on different groups: First Nations people, developing countries, women, immigrants, young people. Can you say anything about how you cut through the diversity of impacts the virus has had?
Well, we deliberately wanted to keep the paper broad. We didn't want to just look at a sliver of the problem. And we actually think that the problems are connected. So the growing levels of inequality in the world, which are linked to neoliberalism, and they have driven a number of the changes which have made the world less likely to have planned for and much more vulnerable to these sorts of effects. So particularly the impact on women, for example, but also young people, is magnified by the fact that there is so much temporary and insecure work now, which means if people are not working, they don't eat. And this, in the third world, where informal work has grown massively, it's the same problem, and this has created huge issues. It is also important to put the points together to indicate that that old cliche, it's the economy stupid, is actually wrong. If you don't manage for the health and well-being of your community, your economy will be seriously damaged. And the pandemic demonstrates that quite graphically. The same with environmental change. There hasn't been enough planning. We don't plan anymore in the way we used to. And so these sorts of problems that have been developed by economic policies over the last 20 and 30 years have really been brought to in sharp focus by the pandemic.
Great. I have a couple of questions about what impact you hope this paper and the research agenda coming from it might have. Firstly, it kind of feels like we're moving beyond the initial hot take stages of discussing the coronavirus, but we're still without really good new data sets to make sense of all these different impacts that you're talking about. I'm just wondering what prompted you and your co-authors to put this paper together now?
Well, it's not that we weren't thinking about these sorts of issues, particularly the people in public health, but also those in industrial relations and economics. We've been thinking about the sorts of vulnerabilities these types of societies were creating and writing about them and researching them. So it's not like we weren't coming from some depth. And really all the pandemic has done, and it's a big all, is that it's brought these problems into very sharp focus. It's because what we're essentially creating is an economic system that is not only unsustainable, but is liable to hit catastrophic disasters, and that it cannot deal with them when they occur. And so our concern also, whereas some of the media and politicians are painting this as a 1 in 100-year event, well, yes, it is at one level, but we should be very careful not to see this as the one and only disaster we are likely to experience. In fact, we go to some point to point out that there have been other disasters in the past, and we are likely to experience more in the next 10 years as issues like resource depletion, climate change, and environmental degradation begin to really kick in, particularly in the context of overpopulation.
That goes really nicely to the last question I had for you, which is again a sort of where to from here question. I'm kind of really aware of that this crisis comes off the back of what feels like a decade or more of crisis, and one in which economists have largely been ignored by the economic policymaking community, at least in a number of the liberal countries. Is there any way that you think we as an academic community can do better this time? What's the role for economics and industrial relations academics in shaping the course out, given, as you say, that the new normal is not going to change anytime soon?
Well, one of the things that this paper highlights, it's really critical, is that we need not just economics and industrial relations, but public health, workplace health, environmental scientists, climate scientists. We need to get together and start working on these issues and get into the public domain. And with the economists, well, some of them were arguing that for comparative advantage and long supply chains and contingent decision-making, flexible labour markets, all the things that the pandemic exposed as completely vulnerable. So we need a really now some of the other economists who've been in a minority are arguing for a fundamental reset of economic policy, and we certainly support that. We need to move to a new economic regime where the government plays a more significant role in planning, and where a new form of globalisation, where we actually encourage countries, rich and poor, to produce the food and the essential goods that they can domestically to their capacities and not rely on supply chains. And that's not an argument against trade. It's not an argument for autarky, but it's an argument for a different set of economic relationships, a more equitable set of relationships where we try to bring all countries forward, and where countries in the third world or the poorer countries that are manufacturing not just for the West, who can afford their goods, but manufacturing for their own people. So we think needs to be a fundamental reset in global trade agreements and a reset in terms of policy making. We can't sit in silos any longer. I mean, many of the colleagues in this paper have been involved in policy debates over many years and making these points. And there are people around the planet making very similar points. So the one big takeaway lesson from this is not a short-term issue. We need to do a fundamental reset. The policies we have in place have not worked. There are some clear directions. We need to cut our dependence so much on supply chains, not get rid of supply chains, but cut our dependence on them. We need more local manufacturing. We need an enhanced public healthcare infrastructure. We need better primary healthcare. We need to make social objectives key, and that includes bringing First Nation people, migrants and women into the equation much more explicitly than they've been in the past in our policy making. So we don't pretend to have all the answers. We provide some guides to what we think the direction should go, but we need a conversation on these issues. The worst thing in the world would be to go back to the same set of policies that have failed in the past, because it won't be very long before we'll hit a new crisis. And the other point I think that needs to be made is this pandemic's not going to be over very soon. It's proved very hard to develop a virus to this type of vaccine to this type of virus. We may succeed. That'll be a very innovative event. But even if a vaccine was developed, it'll probably be 2 years under the best of circumstances before it could get rolled out. So we are not looking at a short-term experience here. And as I've already said, the paper is very cognizant of this is not going to be the last disaster we're going to face. And if we don't do something about this, social cohesion is going to start to fracture. Now, in societies like Australia, which relatively handled, at least to this point of time, and New Zealand handled the the infection fairly well because they listened to public health people, their social cohesion has actually gone up. But if you look what's happened in the United States, where it's been very badly handled, then, you know, it's not surprising that you're getting outbreaks of you know, just conflict and angst in the community. And it's not just the death of the black man, which of course highlights racism. That's the broader issue of inclusivity in the economy and society we need to manage. And we only manage that by putting those objectives front and forward and not just simply servicing the economic interests of particularly narrow groups.
Great. So it's an argument for interdisciplinarity and a radical policy idea. It's time for a radical departure.
Absolutely.
Thanks very much, Michael Quinlan. The article is available at the Economic and Labour Relations Review. It's currently ungated and available to be read.
Is that it?